One of the biggest mistakes we make in medicine is treating a symptom like it's the underlying cause. For example, with diabetes, type 2 diabetes, when we tell people to just lose weight, as if that is the underlying cause of insulin resistance. Insulin resistance is much more complex than that. I'm Dr. Jennifer Davis. I'm a lifestyle medicine specialist. I help women reverse insulin resistance and prediabetes using joyful lifestyle medicine. I practice weight-inclusive care, so I don't talk about weight loss when I'm helping people reverse diabetes. But I have a little story that kind of, if you stay with me till the end, I'll give you some tips on things you can actually do that will help you reverse insulin resistance. So years ago, I had my hip replaced, but before I had the hip replaced, I had hip arthritis, and it was affecting, I'm a runner. I used to run marathons, will run ultra marathons again, but I, went to the orthopedist, and he was like, well, you can do physical therapy. And so the first physical therapy I went through, this is the first, notice that. First physical therapist I went to looked at my gait, and she's like, oh, you walk like this. And she kept demonstrating how I walk. She said, you need to correct how you walk. And I kept saying, I don't know, I can't correct how I walk. So, she worked with me a little bit, but she was like, well, when you stop running, then we can work on this. And I was like, when I stopped running, that's the whole reason I'm here, because I want to run. So I went back to my orthopedic surgeon, and he was like, well, you probably need to go ahead. But there's this new physical therapist that opens, physical therapy center, and it trains athletes. So you could try that, see how it works. So I went to that physical therapist, and they evaluated my gait. And they were like, well, they broke it down, and they were like, well, these muscles are weak. You need to work on this. They did strength training with me. They showed me different exercises to do. And did you know, I didn't get my hip replaced for 3 more years because of COVID. I had to delay it a year. And I ran multiple ultra marathons during that time. And this is after that other physical therapist just told me to walk better. Kind of like when we tell patients to just lose weight. When we tell patients to just lose weight, what happens is we know that weight loss dieting fails. It causes repeated weight loss and regain. You may have experienced that. You may know somebody that's experienced that. Often we regain more weight. And you know what happens? That actually causes increased visceral fat. So worsens insulin resistance. So what is the underlying cause that we're not addressing? So it goes way beyond weight. I can do a whole thing about weight. Bodies come in all shapes and sizes. But what does cause insulin resistance? So there is visceral fat, intracellular fat that can cause problems with insulin signaling. And how we address that is multiple things. Managing stress. Stress is a huge one that we often overlook. Eating whole unprocessed foods, focusing on mainly plant foods, which helps reverse, pull some of that fat out of the cells, improves inflammations, improves signaling, improves cellular function, provides micronutrients that our body needs. We can move our body, walk, run, dance, whatever it is you love to do. It doesn't have to be one specific thing, but ideally something that moves your muscles, causes some resistance to your muscles, maybe some strength training of some kind. You need to sleep well, another often overlooked thing. So restorative sleep is important. We need to avoid toxins, risky substances that can be harmful. Alcohol is a big one, but other environmental substances as much as possible. We need to also connect with other humans. Community, we are social beings, and that's really important. And then my 7th pillar is joy. I mentioned I help people use joyful lifestyle medicine because joy is something that helps us stay present, be grateful, and really enjoy life, which is really important also. So that's my approach. Nowhere in there did I mention lose weight. Sometimes you lose weight as a side effect of doing those things when you work with me. But that is not the primary goal or focus. So I had my hip replaced, and I'm back to running. I will hopefully run an ultra marathon this year. If you are looking for a doctor that practices weight-inclusive medicine, that will not tell you to just lose weight, that will actually help you reach those goals, because I do work with people one-on-one, week by week, to make those changes happen. I also have a group coaching program for women to reverse diabetes. You can click the link below. All of them are there. If you enjoyed this video, please follow along for more and share it with other people that may benefit. Have a great day.